As concerns continue over the Ebola outbreak reported in parts of the Democratic Republic of Congo and Uganda, Rwanda has remained vigilant, strengthening surveillance and preparedness measures to safeguard public health and confidence among citizens, visitors, and investors. In this exclusive interview, we speak with Rwanda's Minister of Health, who provides an update on the regional Ebola situation, explains the measures Rwanda has put in place at its borders and points of entry, addresses international risk assessments, and shares a message of assurance to the international business community.
This regional Ebola Bundibugyo outbreaks was known officially on May 15th when the WHO, World Health Organization, Africa CDC, and the concerned countries declared the outbreak. But going back, the outbreak may have started weeks before, which some experts have reported. So far, there are more than 600, close to 600 cases, mainly in Ituri, in DRC. We've seen cases in Uganda, but there is no case of Ebola in Rwanda. And we've been following closely what is happening in neighboring countries. DRC and Uganda are both neighboring countries, but it's not the first time. It's not the first time Ebola outbreaks happen in those countries. And every time we've activated our mechanism to prepare to make sure we don't have Ebola in Rwanda, and that's what we are doing today. And we're seeing good progress. Uganda has reported no new case for the last 5 days. Ituri still has active cases. They reported more than 40 yesterday. In Goma and Bukavu, there are no new cases, and they seems to be containing and controlling, which reduces the pressure to our western border. But we are still activating our response mechanisms on surveillance, on diagnostics, on contact tracing whenever if it happens. We hope it is not going to happen. And case management, which is how do you treat those who have the disease. So these simulations and rehearsals are very, very important. Diagnostic capacity, test kits. But the most important thing that we need to do as a region is to help containing the outbreak where it is. And we know so many people are involved. Africa CDC, World Health Organizations, several partners. And as a country in the region, although we are not affected directly, but we've been providing our support where possible to make sure that this outbreak is contained quickly, because as far as it stays, it affects all of us, and we hope that soon it will be contained. It doesn't seem to be going away very soon. That's why we need to strengthen our preparedness.
Indeed, there wasn't any case reported in Rwanda, and we understand some of the measures you've just mentioned have also been applied by neighboring countries. Honourable Minister, I would like you to take us through practically and specifically those kind of measures that Rwanda has been putting in place.
Ebola has two, I would say, known, how do I call it? So Ebola is known to be an easy disease to prevent. But it's a difficult disease to manage once you get it. So what it means is that the transmission requires contact, close contact. It requires contact to body fluids, especially when people are handling bodies, when you take care of your loved ones who are sick, when a patient is too sick, and then the family members or doctors handling those kind of patients are the most at risk. So you first have to show symptoms. Then you have to touch those fluids that comes from the body who is sick to be able to get the virus yourself, which is different from airborne diseases like COVID we had. It's airborne are very difficult to prevent. They spread quickly. That's why Ebola is known to be, it's not difficult to prevent. You just avoid people with symptoms when there is an outbreak somewhere. So that's part one. But once you get it, once you're infected, the chance to survive it is 50%. Even the chances are reduced depending on how you receive care, supportive treatment. So we know that as a country, and we don't want to have even one single case, because one single case is too much to affect our economy, our lives, our health system, our social life. Even internationally, having that kind of disease creates panic and fear that sometimes is more difficult to manage than the disease itself. So our investment as a country has been, how do we build strong systems in place at the entry points, at the borders, whenever there's an outbreak or suspected outbreak? How do we test symptoms? How do we manage the movements? How do we isolate and quarantine the suspects? How do we have a laboratory mechanism that will test and tell you, is it malaria or is it Ebola? Because they both have fever as the main symptom. But how do you know exactly if you are not handling Ebola instead of malaria? So you need to practice that, and you need to learn also from the situations. We are learning a lot from the current situation, so that we remain Ebola free as we've been in the past, because we know what it costs to have this outbreak in a country. But also we know it's important to help where there is an outbreak before it gets to you. So we've been providing support where possible, as I said, and we will continue as a country. That's the policy of the government of Rwanda, that the best way to handle outbreaks is to support where it is, to contain before it spreads, because it can go everywhere. It's just one person flying and an incubation period and be detected somewhere else. So you can't be 100% sure, but you can be probably significantly ready. And once it happens, you act very quickly.
I think what I'm going to ask you is what you've just spoken about. Give us a sense or depict what is happening on our borders with Congo and maybe at the international airport of Kigali. Practically speaking, what is happening now when, for example, someone comes to Rwanda? What does this person require to be doing, for example?
So when you come to Rwanda now, at Kigali International Airport, there will be fever screening for everyone. These are automated system. They will pick whoever has fever, because fever is the main symptom for viral hemorrhagic fever, but also other things. So those with fever will be asked questions. Where are you traveling from? If you're traveling from affected countries, there's already guidelines in place. You traveled from the epicenter. DRC has been affected differently compared to other countries. Those coming from DRC, if you are Rwandan, you're returning, and you will be mandated 21 days of quarantine. That has been happening good enough. No one has shown symptoms, and some already completing 21 days. There are those who are still in follow-up. But if you come from a country that is not affected, the follow-up is different. The same applies to land borders. And we are checking all borders, make sure, especially the border we share with DRC, to make sure we don't have people entering Rwanda and having symptoms or having been exposed to Ebola. But the good news is even the border, DRC bordering Rwanda, Goma and Bukavu cities have not had new cases for more than a week, actually weeks. There was only one case in Goma that recovered, and there is 2 active cases in Bukavu that are also recovering. Hopefully next week there will be no active case in the entire south Goma and Bukavu areas, which are close to Rwanda. Unfortunately, in Ituri, far from our borders, the Ebola is still active. There are so many partners involved to contain. It's not yet there. There are still new cases. And Uganda seems to make good progress. They have had 5 days without new cases, and we hope that they continue that way. But if you come to Rwanda today, we can show you 100% that you're safe. There is no Ebola, and systems are in place to make sure you enjoy your stay and you go back home safely. And that's why you don't see any travel ban for people from Rwanda or traveling to Rwanda, because there is no such risk, and because our systems have been taking this very seriously, so that we protect ourselves and the people who are visiting Rwanda.
You also touched on it, but I would like you to kind of depict the way it should be. We understand Rwanda is home to very huge volume of international investments from Europe, from China, from US and other parts of the world. What assurance can you really give to these foreign investors that their businesses are not going to be affected or disrupted by Ebola related cases, be it in Rwanda or even in the region? Yeah.
So if you are an investor or you're doing business in Rwanda, we can also assure you that you won't be affected by Ebola, because there's no Ebola in Rwanda. And we haven't had a case of Ebola, a situation where we deal with Ebola in Rwanda because of systems in place. It doesn't happen by chance. It happens because there are systems to prevent, to detect, and to respond. So our system have been even improved over time, and we can assure all investors and people who want to do their work in Rwanda that Rwanda is safe, and we welcome you, and we continue to support our neighbors, even far away from Rwanda whenever needed, because we know what it means to have an outbreak, a virus like Ebola. But the best way to do it and to support each other is to stop the outbreak wherever it comes from, because you never know where it can reach. And the faster we do that, the better for business, for economy. But Rwanda is safe, and you're welcome.
Yeah, thank you. Maybe, Honourable Minister, as we conclude, we wrap up this discussion. You can choose to answer this or even not answer it. And I'm going to read it the same way I had written. Some international risk assessments appear to place Rwanda at higher Ebola risk, while countries with fewer preventive measures receive more favorable ratings. How do you explain these differences?
So I would always wish to invite those doing assessments and classification to first check facts, science, before you come up with any travel notice or recommendation. Sometimes it comes from just a wish or from uninformed sources. But how would you classify a country at high risk or having same category as the countries with a disease if there is no disease? It's unfair. And many have understood. They take that time to check and verify, which is appreciated. But for a few who just look at the map and say, oh, this country is close to this, then there is a risk. That is, to me, wrong, and it shouldn't be done that way. And it's very unfair and unfortunate that it has happened to a few, but for many, I think facts are more important, evidence to be used all in what we do, because otherwise, definitely the truth will be known. So far, Rwanda hasn't been affected by travel advisories. People keep coming to Rwanda, conferences happening, business people traveling, we have events continue, life continues, and we have measures in place to protect whoever is visiting for a short and long term, and we want to keep it that way without Ebola, and we also continue to support where Ebola it is, so that those countries also can go back to normal business as we do. So Rwanda is safe, and travels are continuing, events, meetings, as usual.
Thank you so much, Honourable Minister, for your time.
Thank you.
We really appreciate your time.
Thank you.
Thank you, sir.